Good evening to you, Doctor. Thank you very much for joining us this evening. I was wondering if you could confirm for us how many patients in the Western Cape are in hospital with COVID or suspected COVID this evening.
Good evening, Sally, and good evening to the viewers. I can confirm it is over 1,000. We've just gone over 1,000 cases, split across the public sector and the private sector today.
And how many people are in ICU with COVID-19?
ICU and high care together, we count them together. There is 190 people in ICU and high care together.
All right. Okay, so those numbers certainly are on the increase. Which hospitals are you most concerned about this evening?
The bigger hospitals for us in the public sector is Tygerberg Hospital and Groote Hospital because they're the bigger ones. And that's where our biggest pressure is being felt. They also have the most capacity, but our bigger pressure in terms of critical and high care and ICU is felt both in Tygerberg and at Groote Hospital.
All right, now that story I just read is that Hospersa and Fiducia are saying that Tygerberg should actually close. It's become a complete breeding ground for COVID-19. First of all, how many healthcare professionals from Tygerberg have got COVID-19?
We have 304 people has tested positive to date, but that is over a period of 8 weeks. Over half of the people have recovered and they've actually turned back to work. So the active cases is 150.
I see. So 150 are currently incapacitated. Would you agree that perhaps the hospital needs to close? And by close, my understanding would be close to new patients. They just take care of who's in the hospital. Is that your understanding too, is what they want?
No, we've got a very long relationship with our chamber, our organised labour. I referred to that previously. And we talk about these things all the time. Tygerberg Hospital is the biggest hospital in the Western Cape. It's got more than 3,000 employees. It is the place where you expect the bigger number of people to be infected. And many of the people infected is actually community acquired, but there are cases where the staff members have acquired the infection in the hospital. We have at numerous times over the last 4 weeks, when there's a confirmed case in every specific unit, we then close the unit for a short period of time, do deep cleaning, make sure that the people are appropriately isolated and quarantined, and that the different shift comes online. So we've been doing it unit by unit, and it's a massive hospital, and we've been doing it in a systematic way. We also have probably one of the best occupational health specialists that works here. I mean, his full-time job is actually to look at the occupational health and safety, the infection prevention control measures in every single part of the hospital. We can understand the anxiety of the staff members because everybody is very anxious at this point in time and being infected. But we also can understand what the unions have been saying, but we are actively engaging. We've never closed any deliberation, and we're constantly talking to our staff and to the unions.
So the hospital, Tygerberg, will stay open?
It definitely will stay open. It's one of the critical hospitals in terms of the number of cases that's coming towards us.
Right, now we know that the Health Minister has been visiting the province, and I was just wondering if you could update us on what assistance you're going to get from national government, whether it's teams coming from other parts of the country to help you out, and how the test kit scarcity is impacting on your ability to find out where this disease is moving across the province.
Thank you for the question, Shelley. I can confirm that as of last Friday, we had a backlog of 27,000 tests waiting in the laboratory at the 3 NHLS laboratories in the Western Cape. Now, 27,000 tests. We've done an analysis of all those 27,000 tests, and as of last Friday, at least 19,000 of those tests were waiting for longer than 7 days. So we are sitting in a situation where we've taken a lot of tests in this province, and the results are being delayed beyond 7 days in many cases. What we have done with our colleagues in NHLS is to prioritize the test for healthcare workers, exactly what you just asked me. So that we know when we test a healthcare worker, we want to get that test back as quickly as possible. And similarly, people that are under investigation in the hospital, we've also prioritized their tests. So we can gladly say that that is starting to be processed, but we have a serious backlog, and therefore we've also, as of today, started changing our testing policy. That we want to focus on people that's in hospital.
Right.
We want to focus on health workers, and then also on people that are at risk, the high-risk population.
I have to ask you about children and deaths from COVID under the age of 18. Parents are so anxious about their children going back to school. Now, we know that there's a 2-day-old that died. We understand that child was premature. It had COVID. Whether it had time to develop the disease, it doesn't look likely. A 2-year-old who had other comorbidities. And I understand that there are 2 teens, a 15-year-old and an 18-year-old. Can you tell us whether they had pre-existing conditions or there were other circumstances that could have led to their demise? And I ask this because if there are, that suggests that possibly COVID-19 was not the cause of death, and yet they are marked as COVID deaths.
Yeah, I can confirm, Sally, that the 15-year-old had a pre-existing condition, a very rare genetic condition, a syndrome, and with that syndrome, the 15-year-old had 3 comorbidities: hypertension, kidney failure, a whole range of things. So that is a very rare condition, and that teen had COVID, but was with very, very many comorbidities. The 18-year-old was a victim of a motor vehicle accident in a polytrauma case, what we call polytrauma, and when presented to the hospital, was already comatose. So the chances of survival was very low. The protocol is in our hospitals, if somebody cannot give a verbal history of whether you can screen them in terms of symptoms and whatever, our protocol is to be on the safe side because we want to make sure that we don't miss a death of COVID. Because that 18-year-old was unconscious, by protocol, a sample was taken. If the 18-year-old was not unconscious, in all likelihood there would have been an ability to do a screening, he or she might not have been tested. But in this case, he was tested. The 18-year-old died because of the trauma-related condition. The chances of survival was very, very bad because it's a very serious head injury and all this together.
But then it doesn't make sense that it's classified as a COVID death. I mean, you know, if you die from a car accident, how can you be classified as a COVID death?
Yeah, so our vigilance is that we are recording all COVID-related deaths. And therefore, because we've taken the test, we're registering that there was a positive test associated with that death. It does not mean that the COVID was the primary cause of death, but that is our vigilance. And it's the same with the 2-day-old, and it's the same with the 1.5-year-old, and the 15-year-old and the 18-year-old. It is the vigilance of actually recording the death. But I can guarantee all parents in the Western Cape, all 4 conditions is very unusual conditions, and it's not that there is a preponderance or a risk that children will die of COVID.
Thank you very much, Dr. Keith Klutter from the Western Cape Health Department.